Just outside Scotland's historical capital lies the University of Edinburgh's Royal Dick School of Veterinary Studies. It's a leading vet training centre and hospital for the treatment of all kinds of animals, from the farmyard to the domestic to the exotic. Now the Dick Vet has opened its doors to reveal the incredible work that goes on every single day. In this programme, Millie the Labrador needs emergency treatment after swallowing something she shouldn't have. A member of staff brings injured wildlife to the school.
I rescued this little leveret from the claws of a buzzard.
And there's a very unusual mystery visitor.
It is amazing what people keep as pets these days, isn't it?
Every day, pets with problems too complex to be treated by their own vets are referred here to the Small Animals Hospital. Waiting in reception today is Freddie, a West Highland Terrier brought in by worried owner Sharon.
Freddie is just past 14 weeks old. He's a lovely outgoing little character, super-natured, really nice, but he has a little problem, but it's one that can be sorted out by surgery. He has a heart murmur. Just a short time after I bought him, when I picked him up and was giving him a cuddle, I could feel a vibration in the front of his chest. But everything else about him was absolutely fine.
As Freddie has grown, his heart defect has become more of a problem.
I exercise him with the other little dogs in the household, but I find that I have to pick him up and put him under my arm and carry him while he recovers. So I thought that the time was getting, needed the operation doing. So he's not coming home tonight, he's going to stay here and get it all sorted out.
Freddie's problems are caused by just one small open blood vessel.
Hey! Hi!
Surgeon Karen Perry explains.
The condition that Freddie has is known as a patent ductus arteriosus, which we shorten to a PDA. It's completely normal for puppies to have it, but it should close in the first 2 to 3 days of life. And that allows the blood to kind of go around the lungs and become oxygenated. And basically what's happened in Freddie is that for some reason the vessel hasn't closed, which means that he's not receiving the amount of oxygenated blood that he should, which is putting extra pressure on the left-hand side of his heart. Unfortunately, his heart is progressively deteriorating and we can't really afford to wait anymore.
Later today, Karen will operate to seal off the vessel.
Right, well I'll hand him over to you.
Okay, that's fine.
Yeah, give him a kiss.
Hey, sweetie. Come on then.
If successful, Freddie will get his energy back. Not everything waiting in reception is a cuddly little pet. SSPCA officer Kenny has arrived with a mystery guest.
It was found in the back garden in Alwa. A member of the public was quite startled when he came running out from the garden, so he phoned us straight away and we came out and collected this wee guy.
Vet Emma Keeble is an expert in wildlife and curious as to where our visitor has come from.
There's no sort of wild animal parks near there that he could have escaped from?
No, everything's been checked out. We've phoned around the usual places.
Yeah. It is amazing what people keep as pets these days, isn't it?
This beast has sharp claws and a fearsome bite, so they take no chances. This is a raccoon native to North America, not Scotland. It needs to be examined and it's safer to restrain it rather than try to give it an anaesthetic. To find out if it has any health problems, it is essential to first find out if it's a boy or a girl.
Raccoons as pets are not ideal. They are very easy to tame, but it's not something we would recommend as a bog standard pet that, you know, anyone should go out and buy. Yes, there are. He did a little bit of weeing and that was obvious that, you know, he was a boy, and I could feel the testicles as well. Definitely a boy. There was a slight difficulty there because he's so overweight actually finding anything. I would say vastly overweight, so we need to go on a diet.
His weight is also a clue as to where he's come from.
It's more likely that he has been just privately owned. In a large enclosure, in a zoo-type situation, he'd be less likely to be so obese, and they'd be watching his diet carefully. Strict diet, I think, increased exercise, and hopefully that'll see him, you know, getting a bit slimmer. Shall we manage him out?
It's off to the local SSPCA centre for a new healthy regime and to find a new home.
So we're contacting sort of established wildlife collections that have got raccoons, hoping to add to the collection. He needs some friends, yeah, some raccoon friends.
Kenny's taking the raccoon to a local SSPCA centre as the search continues for a new home. And sure enough, a few weeks later, he was rehomed, 400 miles away in Cornwall. Freddie the West Highland Terrier is here for crucial surgery on a heart problem, and today is his big day.
We're in chest now.
Freddie has an open blood vessel actually bypassing his heart, so oxygenated blood is not getting round his body properly, as surgeon Karen Perry explains.
This is the aorta here. You see it's beating heart, pulmonary arteries coming here, and you can see here this abnormal vessel is connecting the two, which it shouldn't be. That should have closed when the puppy was born. This here is the vagus nerve, which is running directly over the vessel that we're going to try and ligate. So the first thing we're going to do is to elevate that and put a piece of material around that to hold that out of the way so it doesn't get damaged. And then we'll be creating a tunnel going round and under the abnormal vessel, which will allow us to place some suture material around and then slowly tie that vessel off.
Surgeon Anna Marquez is supervising the operation.
Karen has placed 2 ligatures around the vessel, so there's silk and proline there. So now Karen's going to tie the silk first, closer to the aorta. What we're going to be looking is to see if the heart rate slows down.
Karen has to slowly tighten the threads around the extra vessel. The heart rate will be monitored on the ECG.
25% now.
That's the vessel half closed, and Freddie is maintaining his heart rate. The vessel has closed. Freddie's heartbeat has stayed constant throughout. His heart murmur has gone. Now Freddie can be taken into intensive care. Hopefully, his heart rate will now stay constant. Coming up, Millie's bitten off more than she can chew.
There is a 3-pronged hook sitting the passage that goes from her mouth to her stomach.
Duke gets little sympathy after a possible attack by a Shetland pony.
Here's a right for tormenting her.
And a little hare needs some big treatment.
We are the buzzard's gripped her there. You see it's torn. Look.
The Equine Hospital treats over 3,000 patients every year and is considered a centre of excellence in head and neck surgery, which is lucky for Duke. He's here for an injury to his cheek, which is making it difficult for him to eat. Owner Jamie thinks it might be down to a disagreement with a Shetland pony in a neighbouring field.
There's 2 little miniature Shetlands in the field next to him who he likes to torment. He likes to reach over and nip them and run away for them. I think one of the wee miniatures I've kicked out of him. Here's him right for tormenting him.
Whether his injury was caused by a kick or something else, the vets need to see what's going on inside, so Duke is taken through to the X-ray department. Professor Paddy Dixon, a world-renowned authority on respiratory and dental disorders, is handling Duke's case.
It's certainly more swollen there than the far side, yeah. We'll just get some x-rays and we'll contact you in about 20 minutes, so if you just want to have a cup of tea up there.
Thank you.
Yeah. It's got a lot of swelling under the skin, so hopefully it might be just badly bruised muscles. But I have a feeling, you know, that it is something more seriously. Usually with a bad bruise they'll continue to eat. But hopefully the x-rays will show us what's going on.
Within minutes, the x-rays have come through, and Paddy and vet Russell Parker can see that it's definitely a fracture.
this here is shattered, yeah.
Do you think that's propagating across and up?
There's a possibility there.
Because if so, it might be going up even into the TMJ, which would be
problematic, yeah.
TMJ is the temporomandibular joint, the joint of the jaw. If the fracture's reached up here, Duke will need risky surgery, so another set of x-rays is needed.
We have the fractures along here, 2 separate fractures, and there's a possibility of a fracture higher up. The bone is actually very, very thin there. It's actually paper thin inside, and it's very hard to actually do, you know, put plates or wires on it. Provided the joint isn't involved, they tend to heal very well.
The x-ray shows that the fractures do extend further up the jaw, but don't appear to affect the joint.
We'll just get a scan, just check there's no further damage up there. We'll shave and put on an ultrasound scan, and after that we'll just hang on to him for a few days.
The ultrasound will confirm whether Duke just needs to rest or needs complex surgery. Over at the Hospital for Small Animals, an emergency has just come in.
I did put it up by.
This is a 3-pronged fish hook. Not only is the hook lodged into Millie the Black Labrador's gullet, but the attached line is trailing down into her intestines. Removing this will take the combined efforts of the standby medical and surgical teams of the Dick Vet. Although Millie seems remarkably unconcerned, Surgeon Sam Woods has to explain to owners Church of Scotland minister Maurice Bond and his wife Avril just how serious the situation is.
The concern at the moment is from the radiographs is that there is a 3-prong hook sitting just where her chest starts in her esophagus, so in the passage that goes from her mouth to her stomach. And then there's a piece of nylon going down from this point down into the stomach, and there are a couple of bits of metal swivels which are in the stomach.
Yeah. To remove it will be a high-risk procedure. Sam has to explain the risks involved.
The best way really of dealing with this with her would be to try endoscopically to remove the barb from the throat, and then to do an abdominal surgery to remove the rest from her stomach. The other thing is, if you have something that's coming out with the esophagus into the, for example, around the chest cavity, anything like that, where it's sitting, it could penetrate the base of the heart, and that could potentially kill her. So leaving it is a very, you know, certainly it wouldn't be something that anyone would advise.
So Millie faces a tricky removal of the hook and complex surgery to extract the line from the intestines. She'll be sent to the anaesthetics department as soon as possible. At reception, there's a new challenge for the wildlife team, one from closer to home. Equine technician Jackie Smith has a friend in need of help.
Shall we have a seat and wait, little one? I'm here because on Sunday I rescued this little leveret from the claws of a buzzard down on my farm. I'm trying to hand rear her by myself, but I've brought her over here so that the wildlife vets can check her over and help me towards, you know, feeding her and rearing her and things. So she's getting a little check-up. Get her little nose.
In case you didn't know, leveret is a baby hare, and this one needs some Dick Vet TLC. Vet Livia Bonato, a specialist in wildlife and exotics, is dealing with the case.
The thing with a leveret is you've hardly any chance because of the stress and the shock with them. This is contradicting every rule. It's skipping round my kitchen, sitting happily on my knee, nipping me, doing everything it shouldn't do.
It's quite big actually.
I think a couple of weeks. Now, the buzzard did
when
catch
happened?
her.
Yesterday.
Sunday morning.
Sunday
buzzard.
morning.
Buzzard. In the buzzard's claws.
Okay.
And then she got away. Then me and the dog followed her. The buzzard came down again, and as I went to get her, you know the noise they make when they shriek. So we eventually, you know, got a hold of her. And I just
the leveret's fur is thick enough to hide a very serious injury.
It's probably where the buzzard's gripped her there. You see it's torn. Look.
We needed to close it here.
More than just glue for that,
Yeah, we needed to stitch it, really. We will have to to do the general anesthesia and then to suture the skin, really. So I think it would be better if she stays here. So as soon as I finish with the next appointment, I will try to do it straight away.
As soon as possible, this little leveret will face a big operation. 23-year-old Duke has a fractured jawbone which his owners blame on a kick from Shetland ponies in the neighbouring field. Professor Paddy Dixon and vet Russell Parker are scanning the jaw to check that the fractures haven't extended into the joint.
The fracture there.
So you see the step in the white line of the bone.
If they have, it'll require surgery.
A little bit of bleeding around it as well.
That muscle above it looks quite disrupted as well. It's lost a normal pattern.
Does the angle of the break shed any light on who caused the injury?
The Shetland ponies are not guilty. This blow has gone inside of it at high level, so we'll have to relieve them of all guilt.
Actually just going up towards the process.
See there?
Duke is in luck. The fractures are clear of the joint and can be allowed to heal naturally.
That's about it.
That's fine, yeah. It's got multiple, non-displaced fractures, but a horse, and like a human, they normally eat hay and straw for 16, 18 hours a day, and when he's doing that, he's going to be displacing the fractures. What we'll do is we'll just hang on to him for a few days, just to ensure that he's getting enough nutrition, and then if he's quite happy, we'll let him home at the beginning of next week.
Right.
And we'll keep him on painkillers for about a month or so, Yeah, but the outlook is really quite good because the joint isn't involved. So we're going to feed him a sloppy diet. It's basically a machine has chopped up the hay finely, and we'll soak it, and he can maybe eat this in half an hour a day, and that'll give his jaw time to repair.
Duke is led back to his stable to rest, and owner Jamie is pleased with the outcome.
He'll be fine. I think he just needs a wee sleep. And I'll be up to his mischievous self in there.
This wild leveret suffered terrible tears in its skin following an attack by a buzzard. Vet Livia Bonato and her team must sew up the wounds as a matter of urgency. The investigation revealed 4 separate wounds, each of which must be stitched individually.
It's really scary under that one. Yeah.
With 2 wounds closed, the leveret is turned so that the team can reach the other side. Then Livia and Wendy make an awful discovery.
Sorry. Oh no. I didn't see that before.
One of the leveret's wounds is just too great, exposing the lung to infection.
Oh, shame.
The chest cavity is open, and unfortunately we couldn't see it before. Yeah, end of the story.
There's no room for sentimentality when it comes to an animal's suffering.
It's a wild animal. It will probably not survive the stress, and probably it's contaminated. I even tried to treat it or close it. It will not help. So we will have to do the euthanasia.
Livia has no choice but to put the leveret to sleep.
I'll let Jackie know.
While Wendy goes to tell Jackie the sad news, Livia administers a lethal dose.
I'm really sorry, but
Oh,
have
so
a look.
nice.
You can just see the lungs.
What a brave little thing, though.
They're really big.
Because
They're
it
really
was
great.
doing so well and drinking and... Oh. These things happen.
Okay.
Well, I'm glad I brought her into the train.
Yes.
Although outcomes like this are disappointing, tough decisions are part of the job.
It was frustrating, really, to work so much and try hard, and then it ends in this way. But there are wild animal, and that was the best decision for the little her. So that's it. And it's part of our job.
Good boy.
Just a few days ago, West Highland Terrier Freddie underwent vital surgery to correct a dangerous heart murmur. The operation was a success, and now Freddie can be reunited with owner Sharon.
Who's that?
Oh, he does look strange with his coat missing.
I know.
Oh, he's looking better than I thought. Amazing. Oh, that's sweet.
Good boy. The procedure went very well, as you know. We dissected the vessel. It's got 2 sutures around the vessel, so it's effectively closed. It doesn't have a heart murmur anymore.
Great! You can see how it's healed up already.
Yes, it's doing very, very well. The stitches, they need to come out in about 10 days, so
Right.
your own vet can do that, to be honest.
That's fine.
Now, it's not going to want to rest.
I know.
They need
That's
to
the problem. It's the last thing they want to do. But
I know, and he's feeling very, very comfortable, so I'm sure he's going to want to play. But please keep him as restricted as possible, at least for the next 2 weeks.
But he does look amazing, all things
It does,
considered.
and you know, it's one of the most rewarding procedures for us, because when it goes well, that's it, you know, they're cured for life, so it's very, very good.
Oh, that is brilliant.
Still to come, Poppy is brought in with worrying problems in her gut.
Her clinical signs don't quite fit with her just having disease in her colon.
Students investigate a case of itchy sheep.
It's really yellowy and scabby.
And the emergency team try to remove Millie's fish hook. The Hospital for Small Animals has a dedicated feline team. Owner Keith Pritchard's friend Poppy needs their help.
I'm here to see about Poppy, you know, and to see if the Royal Dick can help out. She's got diarrhea 15 times a day she's going. Our vet's a bit puzzled at it. She's done all the tests and there's nothing really curing her. Okay, Pops.
Vet Kerry Simpson runs the feline clinic. Poppy's symptoms point to a problem from within the gut, but aspects of the case still baffle Kerry.
Obviously she's already had a lot of investigations done, and they've shown up various little things, and not all those things make sense. Because she's passing lots of small amounts of feces, she's showing signs that she's got colon disease, and the small intestine appeared normal, which doesn't fit with what she's doing because she's not absorbing things properly, and that's the job of the small intestine. And unfortunately, inflammation within the gut in cats is something that can progress to be cancer. So we could treat her for the diagnosis that we've got at the moment, or we could do more investigations to try and find out what else is going on, because her clinical signs don't quite fit with her just having disease in her colon. If we did that, then obviously we'd have far more of an idea of what's going on inflammatory-wise, whether there's any signs of cancer in there or not.
Now that Kerry's made the options clear, the investigations can begin.
You're tiny, aren't you?
Poppy needs to be weighed and have some blood samples taken for testing.
All right, good girl.
But it'll be a few days before the results come back, so in the meantime, Poppy's taken for an ultrasound scan. The ultrasound shows that the large intestine and the lymph nodes are very swollen.
You know, glands in your neck, they're lymph nodes, but you've got them throughout the whole of your body. It's where the white blood cells called the lymphocytes sit, and they live there, and then they go out into the blood to fight infection.
Swollen lymph nodes could also mean something more dangerous. Lymphoma, a type of cancer.
Girl, you're so good.
Time to go back.
There's no choice. Tomorrow Poppy will go into surgery to have samples taken from her intestine. Millie the Black Labrador has a fish hook trapped in her esophagus, and the vets need to get it out fast.
I think mine's
A surgical team is on standby, ready to remove the line attached to the hook, which is now sitting in the intestines. But first, the medical team led by Dr. Kerry Simpson are going to try and remove the hook with an endoscope. Two of the hook's 3 prongs are embedded in the delicate esophagus tissue. There's a small chance Kerry can remove it without the need for surgery, but she's going to need a delicate touch. Kerry inserts a small grabber down the endoscope tube.
Open.
She's trying to remove the hook without damaging the muscle underneath. The first attempt hasn't worked, so risky surgery is looking more and more likely.
Does it feel tight or is it?
Just caught there. I might just actually try and see if I can just loosen that bit off with these.
Kerry can't just pull the hook loose. To cause the minimum of damage, she has to delicately try and unhook the sharp tips. She tries to get between the hook and the membrane.
That we like. Okay. Come on, hook. Come on.
One of the surgery team has a suggestion.
If you get hold of the bottom of the J and you can pull that towards you, do you think it might just fall off?
Forward. Okay, we'll try that. Oh, one out. Okay, one out. Next one.
A breakthrough at last. One of the 2 stuck prongs is out. One to go.
I reckon it starts here.
Yeah, and I reckon it goes right up there. So we need to twist this end up and round.
Yeah.
Close. No, open again, sorry. Close. It's stuck there, isn't it? It's stuck right there.
A decision has to be made whether to continue or resort to surgery.
It's going to take quite a bit of force. That's the only thing. It's going to be quite stretchy, and that barb will still stick, but it may well be worth a go.
So if we pull it, we damage the inside of the tube a bit, and it will have a bit of a scratch in its throat, but it doesn't look like it goes all the way into the muscle. But if we can pull it through this, it's probably less traumatic than actually cutting right the way through into this tube at surgery, which is the alternative.
Just going to pull.
Moved it, definitely. Let's go and get that bit, shall we?
It's going to come sliced out along its length.
Sorry, got it.
I think it's out. I think it's out.
We have.
Has done it.
It's gagging. You might want to take it out with your fingers. Served.
That looks like the loop.
Sit there.
Which one's the hook's the other end?
Just give it a spin. Thank you.
Good job, Simpson. Cool with that. Well done, Kerry.
The esophagus has only superficial damage, which will soon heal.
There's another one to get yet.
And there's even better news. The last pieces of line can also be reached. It's a night off for the surgery team.
Thanks, Kerry. That's the best piece of medicine that I've seen tonight.
Kerry, sterling job to get that out, and to get it all out without any surgery. That's great. We're surgeons, but if we can do it without, that's much better for the patient, and yeah, you're really happy.
Millie now just needs a good night's rest and could go home in the morning.
Hello, darling. There's a good girl.
Treating emergency cases is only part of the work at the Dick Vet. Prevention and control of major diseases is also important, especially for the large animal practice. In recent years, a nasty disease called sheep scab has made a comeback. Caused by a tiny mite, it is highly contagious and very itchy and unpleasant for the sheep. Leading a campaign to eradicate sheep scab from the nearby Pentland Hills, Professor Neil Sargison, senior lecturer at the Dick Vets, has set up a group to collaborate with all the farmers in the area.
Our farmers came to us because they were concerned about the fact that sheep scab was a constant presence and a constant menace in the Pentland Hills. The suffering that these animals can suffer from sheep scab is quite unpleasant. Now, most of our farmers identify the problem long before it gets to that stage, but they know it's got the potential to get to that stage, and they're very concerned about that.
So when Neil gets a call out to see some itchy sheep, his first concern is that it might be a case of sheep scab. But to make a proper diagnosis, he and his students must first examine the small flock. And owner Jennifer takes them up to their field, up in the Pentland Hills.
So they're clearly bright, healthy sheep, aren't they? Is it all the time that they're itching, or is it...
It's when, like, every day I come up to feed them, so I bring them across and they eat, and then I see them rubbing up against the fences there.
At that stage, yeah. OK, you have a careful look yourselves first.
It's really yellowy and scabby.
It's hard to tell if it's dry.
Seems quite sort of localised to, like, here back, or just across that bit.
Every time you touch her, she really responded.
Fortunately, Neil doesn't think this is sheep scab. He diagnoses another skin condition.
I suspect that the primary problem is one of dermatophilosis. It's actually quite serious and severe dermatophilosis, and they're a breed that's going to be particularly prone to it just because they're sort of short, close wool sort of breed. And basically the skin gets soaked, and the dermatophilus, which are the bacteria that are causing this sort of crustiness on the ears, then sort of they swim along the back, and then they establish on the back, and they develop all those crusts.
Thankfully, it's easy to treat with some antiseptic spray that will help the skin to heal.
Your big worry was obviously, has she got sheep scab? There is absolutely nothing here to suggest that there is sheep scab. But I'm going to recommend that you treat all of these sheep for sheep scab regardless, because it's such a devastating disease, and it's so important not only from your point of view but from the point of view of what's going on the farms around you.
The antibiotic treatment will take a couple of weeks to work and for the skin to heal. Most importantly, this isn't a case of sheep scab, and Neil was able to advise Jennifer on how to prevent that ever happening. And that is what the large animal practice is all about. Back at the hospital for small animals, the surgery department is hoping to solve a mystery. Poppy the cat came to the Dick vet with a set of intestinal symptoms that just didn't add up, but could suggest cancer. Today's surgeon Anna Marquez is going to investigate.
So guys, you're going to start exploring the abdominal cavity now.
It doesn't take long before Anna has exposed the major organs.
Starting with liver, we've got left lateral, left medial, quadrant lobe.
But she soon gets to the problem area, the intestine.
It's very thick, and if you feel, Karen, it's actually in the wall rather than feces. The colonic lymph nodes are all very plump as well.
The inflammation is in a much greater area than Anna expected. It can't be removed surgically. All she can do is take samples for testing.
Okay.
The results will finally confirm whether Poppy has simply an infection of the bowel, or more worryingly, cancer. Two days later, owner Keith is reunited with his best friend.
Poppy? You enjoying your holiday, are you? You enjoying your holiday?
Keith's already been told the results of Poppy's tests, and it's bad news. Vet Shasta Lynch discusses the options.
The type of cancer that's been diagnosed from her intestine is a type of cancer called lymphoma. This type of cancer can't be treated with surgery, so it's best treated with chemotherapy. Right. The average survival with this type of cancer when treated aggressively with chemotherapy is about 9 to 12 months. So it is still a terminal disease. Whether that's a good option for Poppy or not you'll be the best one to make that decision.
If we don't treat her?
If we don't treat her, then unfortunately her survival will be very short. She's already lost a lot of weight.
You've had your little walk around, eh?
Keith now has to make a decision. Let the condition run its course, or put Poppy through chemotherapy.
I think that's probably the way ahead, you know.
Yeah.
That's what we'll do. We'll do that, yeah.
The decision has been made. Two days later, the chemotherapy course begins in the shape of a simple pill. The But only a few weeks into the treatment, it becomes obvious that this isn't working.
Poppy's cancer was resistant to the treatment, to the chemotherapy, so we have repeated her scan and the cancer has come back despite the treatment. So we've decided that if the chemotherapy is not working, then it could do more harm than good, and it's best for Poppy that we stop the chemotherapy.
Without the chemotherapy, Poppy's only expected to live for a few more months. The vets have done all they can. Poppy's given drugs to control the pain, and she's discharged to spend her last days at home with owner Keith. Still to come, Jules the python needs urgent treatment.
Came home last night and there was blood in our tank. We phoned up the vet straight away.
And how well has Freddie recovered from his heart surgery? The Dick Vet Exotic Department must expect the unexpected. From tortoises to lizards, they specialise in the more unusual pets. Today, devoted owner Sarah has brought in her pet snake Jules, and she's worried.
She's a royal ball python, about 5 months old. Came home last night and there was blood in our tank, our box, and we phoned up the vet straight away.
The python has been straining while trying to defecate, resulting in a small part of her intestine being forced outside of her body, causing a prolapse of the snake's equivalent of a rectum.
Do you check her weight?
Yes, I wear it every time before I feed her.
Resident vet Livia needs to know if there's any underlying condition causing the problem, such as constipation or poor diet. If the tissue remains outside the body, it could dry out and cause serious problems with the digestive tract. Livia and her team must act immediately.
So what we will do again, we will try to reduce the edema of the prolapse and then push it back. Because in this way we maintain the tissue, we maintain the tissue healthy. Okay, and then we will start to investigate. Okay.
A complex problem has a surprisingly simple solution. Nurse Wendy Bayment has years of experience with zoo animals and shows the students how it's done.
He's a little bit jumpy now, so even get your thumb just on the top of the head. Squirmy? Quite squirmy, yeah, that's fine, don't worry.
What better way to shrink a part of the anatomy than with a cold bath?
So we're just going to run that over the prolapse. That feels funny, huh? By putting them on cold, you can cause the vessels to constrict, and then the swelling goes down, and it just naturally will draw back into the body where it belongs. So it just means that we don't have to do anything too invasive. Do you see that's gone in a little bit already? Are you alright? Okay. I know, it's not very comfortable. You see it's stuck back in there. Oh, it's completely gone back in. Yeah.
So all it took was some cold water and TLC.
Oh, it knows, like my bottom's cold. Keep an eye on her and just see.
But Jules's time at the Dick Vet is not over yet. There are tests to do. First of all, there's X-rays, which will show up any internal blockage.
Okay, if you guys want to go out, I'll just try and catch this quickly.
Next, blood tests to check Jules's mineral levels. But finding a vein when the skin is covered in scales is no easy matter. To locate a vein, they monitor a pulse using the wonderfully named ultrasonic crystal Doppler probe. A small microphone to you and me. Once a vein has been found, a small sample of blood can be taken for tests.
So,
Livia has a final check of the prolapsed area.
So it looks alright, it looks nice, so no, I will not do any stitches or anything at the moment.
Okay.
She can now examine the X-rays, which happily reveal only a slight blockage.
On this area, it seems like there are like some opacity, that it might be like a dry feces. I don't see any eggs or any other obvious problem right now.
Last time a cold shower, this time a warm bath. Surprisingly, snakes absorb moisture not only through their mouths, but also through their bottoms. And this treatment will hopefully soften any dry feces and help prevent a further prolapse. The warm baths must continue at home along with an anti-inflammatory drug to help Jules feel more comfortable. Owner Sarah is shown how to administer the drug.
I usually hold their head like a pen, so you've got a head nice and secure, and then this is nice and smooth, and it's wood, so it's not going to cause her any problems.
Yeah, there we go. Opening a bit more. There we go. That's it. And you're just going to direct it to the middle. There you go. You're going to like me for that, is she? It's going into the esophagus, the food pipes. There's absolutely, it's a very safe technique, and it's a very soft tube.
So vets Bridget and nurse Wendy are happy that Jules is in good hands and she can be allowed home. It's 3 weeks since Duke was at the Dick Vet, and Professor Dixon found that he had shattered his cheekbone. Since then, he's only been allowed wet, chopped food and a daily dose of painkillers while the bones heal. Owner Sarah can tell he's on the mend.
He is desperate to get out. When we let him out in the arena, he goes absolutely mentally, rears and bucks and races Abby around the arena and tries to show her he's better, even though he's a wee bit past in it. The swelling's all went down now, but he's still a bit miserable because he can't go out and have a carry-on anymore. So.
Sarah was glad that she took Duke into the Dick Vet, despite thinking his injury was just superficial.
I didn't even think it was going to be a fracture. I just thought I was being silly and taking him through just being kind of paranoid, but then we got there and I seen the x-rays and it was quite bad.
And when he's fully recovered, there's no doubt he'll still be a handful.
No.
Back home in Edinburgh, Jules has been recovering well. Her blood test came back free of any infection. But owner Sarah still isn't taking any chances. She weighs Jules carefully every day and keeps a detailed record.
11 ounces. She's fine. She's more or less back to normal now. She's feeding well. She's doing plenty toilet. Every time she does do the toilet, I've always got that feeling, is she going to be all right? But until, maybe a few months down the line, I'll probably feel like that. She has a bath once a day now. When she first went in the water, she didn't like it. But now, because she's used to getting a bath, she tends to just leave my hand and just slithers into the water quite a thing. Hopefully she'll be okay in the future.
Just a few weeks ago, Freddie the West Highland Terrier had surgery to correct a dangerous heart murmur. Owner Sharon has had a weight lifted off her shoulders.
I mean, his wound was on this side, and you can see how well that's healed. And you could touch it. I mean, there's no problem with him at all. And not having to worry about him is amazing. I thought it would take him a long time to recover because it was a major operation. But within 2 days, he was just wanting to bounce around and do all normal puppy things. Good boy! Now he's just back to normal. And it's lovely to see him so full of beans. It's really good. You're going to play. You're going to play.
Let us pray. We give you thanks for all those we share life with.
In Alloway, Minister Maurice Bond has much to be thankful for. Recently, his dog Millie was rushed to the Dick Vet with a fish hook stuck in her gullet and underwent an emergency procedure.
And the line went right down into his intestine.
But thanks to the skill of the Dick Vet's emergency team, there was no long-term damage.
Hello?
It's a happy day for Millie and her family, and hopefully now she'll be a little bit more choosy about what she finds to eat.
Oh, we're absolutely delighted and over the moon that she's back home, and excitement and surprise for the children coming home. The fact that she's just so well and healthy. We're just over the moon to have her back.